It's Friday, April 17. Good afternoon. I'm Herman Green with your midday news. A special welcome if you're watching online at onespotmedia.com. The permanent secretary at the Ministry of Health, Dunstan Bryan, is now in quarantine after an employee at the ministry tested positive for COVID-19. The employee tested positive on Wednesday after he reportedly complained of feeling ill. Operations at the ministry's head office in New Kingston have subsequently been suspended and contact tracing investigations have started. The permanent secretary, who is among several workers who have been quarantined, says he was tested for the coronavirus.
I tested yesterday and my result came back. I am confirmed negative. At this time, however, the protocol requires me to be in quarantine, and I have chosen to be quarantined in facility and not at home. Therefore, I am locked away for 14 days out of an abundance of caution to ensure that there's no possibility of any ill effect of this contact that I would have had.
A news release issued last night by the Health Ministry said the Kingston and St. Andrew Health Department will continue to interview and test other staff members who had close contact with the employee who tested positive in the last 14 days. The ministry said, in keeping with its protocol for infection prevention and control, the decision was made to suspend operations at its head office today. The building will be sanitized and is scheduled to reopen on Monday. And questions have been raised about why Jamaica is still seeing imported cases of the coronavirus more than a month after the country closed its borders. Wednesday, the Ministry of Health reported that there were 2 imported cases of the virus, a 2-year-old boy in St. James and a 43-year-old woman in St. Catherine. Opposition spokesman on health, Dr. Maurice Guy, raised questions at Thursday's virtual Special Select Parliamentary Committee.
My understanding that we closed our borders on the 25th of March. We are 22 days now into post-closure of the borders. How do we now have an imported case of a 2-year-old?
It is possible that they could have come in infected and they would have gone through a symptomatic phase. And then now, because what we're recognizing is that sometimes up to 3 weeks in some of our cases, we have cases now that are still not clear of the virus up to 3-4 weeks after. Mm-hmm. So we do recognize that you can have the time frame for the positive of test can be very variable. There is a possibility that the child could have come in unaffected, mm-hmm. and then be infected by the individual who we were tracing.
And the opposition is calling for a complete shutdown of the country to stem the increasing spread of COVID-19. At an online party press conference on Zoom Thursday, PNP member and former Chief Medical Officer Dr. Winston Delahaye insisted that the current approach of the government may lead to a catastrophe.
What's going to happen is we've started with St. Catherine, next is likely to be Kingston and St. Andrew, then another parish and another, moving around the mulberry bush, as obtained in Italy. The experience has been there. I'm not the brightest person in the world, I read, and so I know what I'm saying to you. Let's not repeat those mistakes. Now is the time to make plans, adequate plans, not in the manner in the experiment of Tuesday night with St. Catherine, adequate plans to shut the country down.
He believes this is the only way to prevent further spread of the virus. Dr. Delahaye is also questioning the government's decision not to use a suggested COVID-19 medication from Cuba.
What possesses a government to shut the door on potential products that could help persons who are dying? I would happily want to take chloroquine if that's available. I would happily want to take interferon if I become positive and then become in need of that. There's a University of the West Indies where I work, and just before this program, I spoke with Carl Bruce, who heads up the clinical services at the hospital. We would all be happy with the political will to conduct clinical trials.
The People's National Party is chastising the government over the closure of the Compassionate Care program yesterday. Shadow Minister of Labour and Social Security, Horace Daly, in a release, said the abrupt end will cause more hardship. He's suggesting that the government processes the over 388,000 applications already received. He also says the portal should be reopened to allow those who had encountered glitches with the system an opportunity to complete their application. Mr. Daly believes yesterday's closure of the Compassionate Care Program will be too much for these categories of persons to bear. The program was opened to tertiary students, the unemployed, the informally employed, as well as the elderly and pensioners. And Finance Minister Dr. Nigel Clark says the closure of the Compassionate Grant is to process payments for the over 400,000 applicants. Dr. Clark was a guest on Power 106 Morning Agenda today.
Account that does not match the name. Many persons, we have learned, would have said, I have a bank account, but my son has one. And they put their son's account number in, right? Some people would have done that. We're going to validate a bank account, and the bank accounts need to be in the name of the applicant. When we do that validation and we find that for this particular application that is not the case, we're going to have to message in terms of text messaging the applicant and getting them to change.
And with the parish lockdown now in effect in St. Catherine, residents are questioning what will happen with their obligations to financial institutions. It was one of the queries raised on TVJ's virtual town hall Thursday night.
We are looking now to the banks and the financial institutions as to what are their stimulus package like. Are they going to rewrite the loans, give moratoriums? We're not hearing that depth from the financial institutions, and this is some cause for concern. That is definitely something that we need to look at. You have small businesses that operate from a day-to-day basis, and the fact is they don't have the reserves to call upon. It is based on cash flow that they got the loans, and when there's no cash flow to pay the loan, then they are in a serious strait.
Meanwhile, there was this suggestion from the president of the Sunshine City Chamber of Commerce, Norman Walker.
They'll be left out of the net. They'll be exposed. There won't be any coverage for them. And I'm saying that those of us who are employer of labor, I would like to see that some sort of stimulus is provided, maybe by the financial institutions that we are connected to see how best they can really support us through these turbulent times, so that we can keep some of the people that we're employed, and to see how best we can compensate them to survive. Because this is what we are facing now. We are all in this thing together, and I would never like to see any employee left behind, because it is something that they are not responsible for.
And we now take a break here on the Midday News, but stay with us. There's more when we return. Welcome back, continuing the news. Business operators in the corporate area have been complying with government's imposed restrictive measures. Now that's according to the Mayor of Kingston, Delroy Williams. Mr. Williams says a team of building officers from the Kingston and St. Andrew Municipal Corporation conducted an operation yesterday. The team inspected several businesses, ensuring that operators were complying with measures put in place by the government to help contain the spread of COVID-19. Call centers in the area were among those inspected.
So they had a mix of some persons working at the call centers and some working from home. Those who were working at the call centers, the call centers were on entry, you have to sanitize, and on leaving, you have to sanitize also, that the headsets were sanitized frequently. The desktop areas also sanitized. They were wearing masks, and that they sanitize before, in the mornings, before lunch, and after closing hours.
While stores have utilized floor markings to ensure physical distancing among customers, Mayor Williams says there are other challenges, particularly for the supermarkets.
The difficulty most of them have is on the outside. Even though they have put in place the markers, they are saying that shoppers are not entirely adhering to the measures they have put in place, but they do repeatedly try and ensure that the shoppers comply and adhere to those measures.
And the mayor of Kingston is making an appeal to the employees of the Alorica call center in Portmore, St. Catherine, whom the health ministry are unable to locate, to reach out to the ministry. On Thursday, Health Minister Dr. Christopher Tufton said the ministry was unable to locate 112 of the call center employees due to discrepancies with contact information they provided to the company.
The age-old issue of if you give certain addresses, they feel that they would not gain employment at the call center, and so there are persons who elect to use other addresses. And we ask those persons who have worked in the environment, who are aware of the current issue at a particular call center, that those persons to go in and make contact in terms of making a phone call to the Ministry of Health and using the toll-free numbers provided.
Dr. Tufton said the government will examine additional measures to track the missing employees, such as publishing their names. There's a renewed call for members of the public to stop buying N95 masks, which are in short supply and are needed for healthcare workers who are helping to treat COVID-19 patients. Medical doctor Michael Abrahams addressed the issue in an interview with TVJ News on Thursday.
Recently, I came across this new technique to sterilize masks, and we use them, the N95 masks, but it's not being widely used, it's just being spoken of. So we really still have an issue with having enough.
Meanwhile, as the production of cloth masks increases, one St. Catherine resident is making her contribution to Jamaica's COVID-19 fight by donating to a set of frontline workers. Nardia Campbell recently donated 50 masks to the Spanish Town Police and is asking for help with materials so she can make more to give to other stations.
It's definitely be within our guard room area and outside the operational team. Even inside the offices, persons are still doing their regular duties and persons are still coming to the police station on a daily basis. It has not dropped one bit. It has probably increased because more persons are at home, so they are doing their personal business, so they have time now to come to the police station, so they are here.
The health ministry is again insisting that there is a protocol in place for funeral homes, explaining how bodies associated with COVID-19 should be treated. Speaking at a press conference yesterday, Chief Medical Officer Dr. Jacqueline Bisesa McKenzie said the protocol was sent to funeral homes on March 14, but some funeral operators continue to raise concerns that some operators in the funeral industry are not registered, which raises concerns about hygiene practices.
Wherever there is non-adherence to infection prevention and control measures, that is a major source of concern. We do recognize that when we have had 2 meetings so far, and I've encouraged the team to have more meetings. If you are speaking about persons that are not registered, then it may be that those persons are not showing up at these meetings. Exactly. The protocols have been widely distributed, and I think based on this information that you are indicating now, I will indicate to the team that where we have knowledge of persons that are informal, then we need to also try to visit those areas to ensure that the measures are being put in place. Because
now, countries around the world have different protocols on handling the corpse of a COVID-19 victim. In Singapore, for example, collecting, casketing, and transporting bodies for cremation or burial is restricted to companies whose employees have undergone a basic infection control course by that country's National Center for Infectious Diseases. Standard & Poor's S&P yesterday affirmed Jamaica's B+ long-term foreign and local currency sovereign credit ratings and revised its outlook from stable to negative. S&P says the revision in outlook reflects the impact of the presumed prolonged shock from the ongoing global COVID-19 health crisis on the Jamaican economy. It further estimated that the pandemic will negatively impact gross domestic product and the external and fiscal accounts. This, S&P notes, is due largely to significant declines in tourism and related activities and an overall reduction in foreign exchange earnings and tax revenues. However, it believes that the economic contraction will be more moderate than many other Caribbean countries due to the high level of diversification of the Jamaican economy. We go now to news in sports. Jamaica's young swimmers may see regional action this year as the 2020 Carifta Swimming Championships could still go ahead later this year. The 2020 staging was set for April 3 to 15 in Barbados before being postponed due to the ongoing pandemic. Speaking on CBC's Sports Night this week, President of the Barbados Aquatic Sports Association, Tony Selby, said there has not been a decision on pushing the championships to 2021.
I don't anticipate that it will be likely to hold the championship before December this year at the earliest. The pool is closed and the pools throughout the region are closed. So obviously athletes will need to be training for a period of time. And unless schools open in September, I really can't see this being possible. And you have to appreciate that it needs to be consistent throughout the entire Caribbean. In other words, this Carifta involves all of the federations throughout the Caribbean. Protocols in all of those countries, including travel protocols and the like, would all need to be favorable for such a competition to take place.
Jamaica finished second on the table in 2019 behind the Bahamas, who won their third straight title. And that's where we wrap up the Midday News. I'm Herman Green. Remember, join us at 7 for the primetime news package. On behalf of the entire team, good afternoon.